Hello, Mr. Munyon. My name's Dr. Kendrick. I looked after you while you were on the remote monitoring ward alongside Karen, who was our fantastic nurse.
Yeah, an absolute pleasure to meet you. And at the time, I described you and Kerry as my lifesavers.
So Brian was really poorly with COVID. He went from being a completely fit and healthy man to being really poorly with COVID, and he came out of hospital on quite a lot of oxygen, 4 litres of oxygen. He deteriorated and he had to be readmitted to hospital, and that was because he developed a complication of his COVID in that he'd had developed blood clots on his lung, which needed further treatment in hospital. But then he was discharged again on the remote monitoring system after they'd sorted out that complication that had developed probably before his discharge, but only became apparent on discharge. And then he was then looked after at home through remote monitoring.
It was really good, and the recovery at home was significantly better than the hospital. The hospital was very difficult, and it changed the course of my illness.
Yeah.
I wouldn't like to think if it didn't have it. If that wasn't available, I would hate to think of the consequences of staying in the hospital longer.
So our service is from 8 a.m. till 8 p.m. We just to the doctor, we observe the patients on daily basis, 3 to 4 times a day. They submit their observations, and then we normally routine is that we have a virtual ward round between the doctor and the nurse when we discuss every patient and make a plan on daily basis. Without a doctor, there is no way I can monitor these patients. So that is the backbone of the service, the doctor.
So we set up our remote monitoring virtual ward in January in response to the pressures that the acute trusts were facing with COVID patients, and we've successfully managed to discharge 43 patients now onto remote monitoring from hospital, reducing their length of stay in hospital, allowing them to be looked after in their own homes, which is what patients want. We can use this for other clinical conditions such as heart failure. We're looking at it for other respiratory conditions. We've obviously looked after people with COVID, pneumonia. We're now looking after people with other types of pneumonia, for people with chronic obstructive pulmonary disease, and we're doing that in conjunction with our integrated community respiratory service. We're also looking at it to monitor people who've been discharged with a fall at home, and we're also really excitingly looking at it to monitor patients pre-operatively to prevent cancellation of operations because of problems with blood pressure or anemia, and then post-operatively to allow people to go home on the same day of surgery.